COVID-19, China confronted with its gray areas. If we stick to the official figures, the official record of COVID-19 in China is flattering compared to what the rest of the world has experienced. As of Tuesday, which marks the anniversary of the first official case to appear in the city of Wuhan, there were nearly 93,000 infections and 4,743 deaths across the country. This makes the Chinese giant the 68th country with the highest number of patients and the 38th with the most victims, according to data from the Johns Hopkins University benchmark site. In other words, only 0.32% of the 1.4 million deaths recorded so far come from China. Compared to its immense population, the finding is even more striking since the country has a little more than 3 deaths for a million inhabitants against 1,436 for Belgium, the most damaged state in the world, in proportion. These figures, however, have been questionable since the start of the epidemic. Confidential documents revealed Tuesday by the American channel CNN confirmed this. A report from the Provincial Center for Disease Control and Prevention of Hubei, the region of which Wuhan is the capital, states on February 10, the day of the visit of leader Xi Jinping to the epicenter city of the pandemic, of 5,918 new cases detected in the province. On the same day, the Chinese authorities reported some 2,478 for the whole country, less than half. Likewise, another document mentions on March 7 a total of 3,456 victims since the start of the epidemic, when it was still officially 2,986. All of this seems to confirm the idea that the Beijing regime has downplayed the seriousness of this disease, even if CNN assures that this leak, orchestrated by an anonymous whistleblower, does not provide proof of a deliberate attempt to deny. The channel specifies above all that all the information contained in this 100 pages illustrate how the Chinese health system seems to have been taken aback by this crisis and that it did not have the appropriate tools to manage it. Rigid bureaucracy, difficult recognition of suspect cases, effective tests, average time of 23 days to confirm a case from the onset of symptoms. The challenge to the official discourse is, however, far from unprecedented. Last spring, testimonies and photos of funeral urns stored in crematoriums in Wuhan already suggested that the toll could be much heavier than that mentioned, without tangible evidence to prove it. The emergence of the virus in Wuhan is the subject of debate. But for the first time, formal documents shed light on a small part of the many gray areas that persist around the COVID-19 pandemic. Starting with its exact origin, which would prove to be invaluable in the global knowledge of this virus but which seems to clash today with the narrative imposed by Beijing. The British newspaper The Guardian thus evoked Sunday an intensification of the propaganda of the mode on this subject. Chinese scientists have even submitted an article to the medical journal The Lancet claiming that Wuhan is not the place where human-to-human transmission of SARS-CoV-2 first occurred, the report said. Daily. Instead, they suggested that the first case would come from the Indian subcontinent. These claims are considered speculative at this stage by the World Health Organization, with no evidence to support this. What is true, however, is that the first cases spotted in Wuhan in early December are not enough to demonstrate the opposite. The place where an epidemic is first detected is not necessarily where it started, indicates the WHO on its site, not excluding that the virus has circulated elsewhere, silently. The Chinese government itself initially designated a Wuhan market as a likely starting point. But a Lancet study has since questioned this hypothesis since a third of the first 41 patients hospitalized for this disease did not have a direct link with this place. Documents unveiled by CNN also report a significant increase in influenza cases in December in Hubei, up to 20 times more than the previous year at the same period, in Wuhan but especially in the neighboring cities of Yichang and Xianing. This phenomenon is not directly linked by the local authorities to the appearance of COVID-19 at the same time, but it questions how it could have contributed to accelerating the spread of the new coronavirus. Animal and Specialized Laboratory. The WHO, for its part, is trying to convince Beijing to be more transparent. The UN agency hopes to send an international team to China in the near future, whose mission will be to trace the origins of the virus. This question itself refers to the main unknown concerning the epidemic: how did humans come to contract SARS-CoV-2? If the animal origin seems more than likely, and would involve the bat, we do not know what could have happened next. A suspected time, the pangolin is perhaps not the intermediate animal which would have transmitted the virus to the first man. At this stage, nothing can rule out the accidental origin of a virus present in a specialized laboratory, in this case the P4 laboratory in Wuhan. China has always formally contested these accusations, brandished in particular by Donald Trump, which would constitute a fiasco for it. A year after the first confirmed case of COVID-19, and while many countries still face the epidemic wave, the mystery remains. The boss of the WHO, Tedros Adhanom Ghebreyesus, promised it again Monday. We want to know the origin, and we will do everything to know it.